The numbers are truly terrifying. From 2002 to 2013, the rate of heroin-related deaths in our nation nearly quadrupled. And in Massachusetts, there were more than 1,000 opioid-related deaths last year alone. That's why the White House today announced a new $2.5 million program aimed at stressing treatment over prosecution. The effort will, for the first time, pair public health workers with law enforcement officers, who will aim for wider distribution of medications used to reverse overdoses. They'll also be looking to get the word out quickly when they find any batches of heroin tainted with other deadly drugs, such as fentanyl. And to that end, Massachusetts Attorney General made an announcement today as well, seeking to make the trafficking of fentanyl a crime. Attorney General Maura Healey joins me now, along with Cathy Fennelly, whose 21-year-old son, Paul, died of a fentanyl-related overdose this past February. Thank you both for being here. Attorney General, when it comes to the opioid epidemic, is fentanyl a driver or is it more of an aggravating factor?
Well, I think it's both. What the public may not know is that they may have heard of fentanyl as an incredibly strong pain reliever, but what they don't know is that increasingly it is showing up laced with heroin. Heroin is often laced with fentanyl, and sometimes it's showing up by itself. And so many people are ODing from fentanyl, and because it is up to 50 times more powerful than heroin, more and more people are dying from fentanyl. So it's incredibly dangerous, incredibly powerful. It's why this new legislation is needed to make the trafficking of fentanyl a crime. You say it's showing up more and more. Can you quantify how prevalent it is? I mean, you know, how much heroin in Massachusetts that's, say, confiscated by law enforcement contains some trace of fentanyl, or what percentage of overdoses involve fentanyl? Well, Adam, you just reviewed the numbers. I mean, they're really staggering. This is a public health crisis. So many families and communities are suffering. We're seeing it showing up on an it is more prevalent, it is more increasing in terms of its presence. From our investigations, from some of our seizures, and speaking with my colleagues in law enforcement, district attorneys, police, state police, and others, increasingly we are seeing more and more fentanyl on our streets. The drug cartels have figured it out, Adam. Fentanyl can be manufactured. It's a synthetic opioid, and it is incredibly dangerous and incredibly potent, and now it is being trafficked into our states, and people are dying. Cathy, I want to get to you in a sec. I was going to ask you where it came from, and I think you just answered the question. So drug cartels are manufacturing it. It's not coming from medical institutions or anything like that, or prescriptions? That's right. We're talking about a drug that is manufactured by drug dealers, drug traffickers, and drug cartels, and it is incredibly dangerous, incredibly potent. Okay, Cathy, let me turn to you. Can you tell me a bit about your son, Paul?
My son, Paul, as you said, passed away in February of this year. You know, my son started out as having a mental illness. I've known that since he was little. About the age of 13, he started using marijuana, caught him. You know, he kind of, every kid does it kind of thing. You don't think nothing of it. Then he started coming home drunk, but it was horrible. So we instantly took him and put him away somewhere to get help, and we thought everything was fine, and then it escalated into prescription pills. And then I kept up with everything I was supposed to do, and then we found out he was taking Oxy 80s, and then after that, obviously, the money, you can't keep up with that. It's so much money. And if you can't be an addict and hold a job, well, you can, but it's hard to come up with the money and the funds. That's where heroin comes in. It's so much cheaper. $10 versus 80 or you know, $120 for a hit.
Which is one of those things that surprised me every time I hear it, and I've heard it again and again. You would think that the more intense drug would be cheaper, the more dangerous, or pardon me, the more intense drug would be expensive, the more dangerous drug would be more expensive, but that's not how it is, right?
No, it's not. And I can sit in a room full of 2,000 people whose child or loved ones are going through it. It's the same story, just insert a different name. This drug literally takes over.
So when he overdosed fatally, he was using a batch of heroin that contained some fentanyl, correct?
It was laced. He didn't know.
I was going to ask you if he was aware of that.
Yeah, it's actually on his death certificate.
It has the actual,
believe it or not, fentanyl killed him, not the heroin.
Really?
Yeah, it's stated right here that it was an acute intoxication by combined efforts of fentanyl, then it says, and opiates.
Do you think he had any inkling as a longtime user that this was a risk that was out there?
No, and I don't want to be naive to say that he didn't think about it, because I always said to him, look, there's bad stuff out there. And there is no good batch of heroin, but this is fatal. You don't survive. It's not reversed by Narcan. I mean, it's an instant
Oh, it
death.
isn't? I didn't know that, actually.
I was heard, I don't,
It is so powerful. As I say, it's estimated to be 30 to 50 times more potent than heroin. So you don't have a chance with Narcan. And you could put an amount of fentanyl on your fingernail, and that would be enough to do you in. And as Cathy said, Paul probably didn't know that there was fentanyl in the batch. You can't discern that. You can't tell. It looks very similar. But that's why we need this action around the legislation, because it is so deadly and it is out there killing people.
My understanding is that there are some laws on the books that would allow prosecution for individuals who had fentanyl, but not necessarily the sort of prosecution you want to engage in. So what would your legislation change?
Well, what it would do, it would create a crime to traffic fentanyl.
And what's the distinction between trafficking versus possessing with intent to distribute?
We've been clear about this, Adam, that we, I think in law enforcement, we recognize this as a public health crisis, and we're not talking about the low-level offenses here. What we're talking about is a drug that is incredibly dangerous and lethal and that is killing people. And so we want to make the trafficking of that drug a crime in the same way it is a crime to traffic heroin or cocaine.
And pardon my ignorance here, but just as a layperson, does trafficking mean the actual sale of it? If you have someone who manufactured fentanyl and then was providing it to someone who had a supply of heroin, is that the trafficking? Or
right.
Just define
right
it for
now,
me
there is a crime right now. It is a crime to possess fentanyl. It is a crime to possess fentanyl with the intent to distribute. But what doesn't exist right now is a weight class for that. And what we are proposing is that we consider the sale, the distribution of 10 grams or more of fentanyl to be a trafficking offense. What does 10 grams look like? It's about the size of your finger.
So lethal many times over, basically.
Many times over. So we think that is exactly the kind of legislation that's needed. 10 grams, as I say, it may appear to some to be a relatively small amount, but it isn't when you talk about how many lives that can damage. So what we're talking about is creating a crime of trafficking fentanyl, and we think it's the appropriate measure.
Up to 20 years in prison, right?
Up to 20 years in prison. And when you think about drug cartels and drug traffickers that are bringing a drug that they synthetically manufacture into our state, putting it out into the streets, a drug that is killing people, they don't even have a chance. If they ingest this, they don't have a chance. I think it's appropriate that we take this action to shut down this kind of drug trafficking.
Just briefly, because I want to give Cathy the last word here, Beacon Hill has a history of killing ideas that seem very reasonable. Is there any indication that there might be surprise opposition to your proposal?
You've seen and you've heard the face of addiction, and we see the face of addiction in families and in communities across the state. And I think all of us recognize that we need to do everything and come together on this. I am pleased that this bill enjoys support from district attorneys, from police, from the major chiefs associations. The chairman of the Judiciary Committee, John Fernandez, is sponsoring this bill. And there's bipartisan support, which is what's needed, because the time to come together is now on these issues.
Cathy, question for you. The AG is doing what she's doing. We've seen this bigger push to get Narcan in the hands of people who need it. Also a push to treat heroin as get treatment for people who are addicted rather than punishing them legally. As someone who lost a loved one due to addiction, what is not happening right now that you think should be? Just maybe one important thing that we should be doing that we're not.
There's so much.
So much?
And I said earlier today, the one thing is, like, people want that fentanyl. They know it kills you, but they want it. It's a pure high. That's the scariest part about this.
That's very, very frightening.
Scary.
All right.
But...
Cathy Fennelly, thank you for coming in. Sorry for your loss.
Thank
Attorney
you.
General, thank you as well.
Thank you for covering this.
Thank you.